It's National Stroke Awareness Month. If you have a loved one who has suffered a stroke, how do you best advocate for them? Damage from a stroke can be widespread. You can go from regaining full functioning to being left with very limited functioning and every level in between. Some of my most challenging clients are ones that have had a devastating stroke. It's important to be patient. Recovery can be very slow. Your first step is to get to the hospital as quickly as possible. Hospitals are trained to recognize the signs of stroke. For a stroke that is a result of a blockage in an artery, treatment needs to be started within 3 hours. Most stroke survivors stay in the hospital for 5 to 7 days. Be patient though. Recovery can be very slow. Often, people need to go to rehab after a hospital stay. There are several types of rehab: an LTAC, long-term acute care, IRF, inpatient rehabilitation facility, skilled nursing rehab. We will be posting another video that goes into more detail on types of rehab and how insurance pays for different types of rehab. It's important to know the difference so you can advocate for the most appropriate level of care for your loved one. After a hospital stay or rehab stay, your loved one may require home therapies to continue treatment. There are different types of therapies: physical, speech, or occupational therapies, home nursing care, or wound care, to name a few. Some paid for by insurance, but there's also private pay options that might be beneficial. It's important to note that in order for Medicare to cover skilled care, whether home or in a facility, the burden is not that the person must be making progress, but rather an individual's need for skilled care to maintain their current condition or prevent deterioration. Most people do not know this. We're also going to be posting a video that goes into this in more detail. Finally, if a loved one has a devastating stroke and is not able to return home, where do they go and who pays for that? Depending on their level of functioning, they might go to an assisted living facility or a skilled nursing facility. Note, Medicare does not cover long-term care. Medicare covers up to 100 days in a skilled nursing facility. Key words: up to. After that, it is the financial responsibility of the individual. Medicaid does pay for long-term care, but Medicaid is state-specific and can be tricky because there are a lot of rules around the finances. We will also be posting a separate video on paying for long-term care. Having a stroke can change your life in an instant. Being well-informed can help you advocate for yourself or a loved one. To learn more about our healthcare system and how to best advocate for yourself or a loved one, I want to encourage you to follow along. If you have questions, drop it in the comments. We'll try to answer, point you in the right direction, or even post a video, because you are not likely the only one with that question.